Welcome to the To Your Health podcast, your go-to source for everything health, fitness, and the latest medical insights. I'm your host, Rhonda Alfred. Joining us today on this episode is Dr. Patrick St. Martin. He's a sports medicine physician at Terrebonne General Health System. Welcome to the show, Dr. St. Martin.
Great to be here.
All right, well, let's get started with you telling us a little bit about yourself and your role at Terrebonne General in sports medicine.
I was raised in Houma, went to Vanderbilt for high school, went on to actually LSU through and through. So I did college at LSU Baton Rouge, went on to med school in Shreveport, did my family medicine residency there, and then my sports fellowship there as well. My role currently here is I'm a director of sports medicine.
Okay.
And that means basically that we cover all the high schools here. All of them have trainers that I work with there in order to keep these athletes in play.
Yes, keeping them safe in the game, correct?
That's right.
All right, well, tell us more about what exactly is sports medicine.
So sports, at least for me, is my background started in family medicine. So it's a subspecialty within family medicine. And that basically means that I will see people from, basically birth until death, right? So all ages. And, we really see everybody as being an athlete. If they aren't currently active, we encourage them to be that way. And I think it's one of our main tenets in sports medicine.
So it differs a little bit from general medicine, or is it all
Yes.
kind of?
Yeah, I mean, I think it's the similarity with family medicine is that we see all the age groups. Depending on which sport or what kind of level of activity they're participating in would kind of guide you on what's going on with them if they're injured.
So what inspired you to get into this field of sports medicine?
I had some really great teachers in my training. So in family medicine training, we had our sports doctors that would come and precept us or mentor us. And I got exposed to them early on in my training. And I really liked how they viewed different illnesses or pathologies, how they went about diagnosing, treating, preventing those things. And I just fell in love with and decided probably my intern year, so my first year of residency, that I wanted to pursue sports medicine.
And what are some of the most common conditions that you treat?
So kind of going back to the age thing, it depends on what sport they play and what age they are. So if you have really young kids, they tend to deal with certain issues. Your adolescents would deal with other issues, and then obviously older individuals. So I guess an example would be younger kids, their tendons and muscles are stronger than their bones. So they tend to get issues like what we call apophysitis, where they have like a growth plate issue. And as they mature, they tend to get things that adults would get. So it all kind of depends on the joint or the, what is causing them that pain or how they injured it.
Right. And what if you're like a tennis player and you're an adult? I mean, what kind of?
Yeah, so tennis, funny enough, there's something called tennis elbow, where it's a tendon issue in the elbow, but I see it probably more commonly in like our workers than I do in tennis players, but
really?
more occupational, I guess. I've only seen it a couple of times in an actual tennis player, but we do call it tennis elbow.
Okay. Well, how do you incorporate injury prevention into sports medicine?
Yeah, I think it's a focus for the field to see how can we implement certain things in order to prevent injuries in the future. Well, I'll give you a couple examples. One of them has to do with throwing athletes. So kids that play baseball and softball, they tend to get certain types of injuries of the shoulder and elbow. A lot of them are what we call overuse injuries. And there's actually a pretty good reference on the littleleague.org website that gives pitch counts for ages. So we know that if you can limit the amount of pitches that they throw, you can limit their chances of getting injured. So that's one. The other one revolves around what we call sports specialization, which is a kid that would start playing one sport early on, like between the ages of 7, 8, 9, and only play that sport at the exclusion of all other sports and activities. They're at much higher risk of getting injured. So we encourage them to play multiple sports growing up and maybe specialize into one later on in high school.
Right. That way they can kind of develop all of the muscle groups and
So they
everything.
can, finish growing and maturing before they go into one sport only.
Yeah. How is your approach different with youth athletes as opposed to older adults?
So it really just depends on, again, what sport they're playing. Can we set some things in place that can help them succeed and not get injured if you're a young athlete? So kind of going back to the prevention thing that we are talking about. And older individuals, I always, encourage them to be active. I think we should remain active all the way through our lives. And if you do that, your chances of avoiding injury and pain and joint issues are much greater. So you want to continue to do that. And that's a part of what I do when I meet with patients is seeing where they are, and how can we get to where you want to be, your goals.
Right. So depending on where you are you finding that children are playing more and more sports at an earlier age now?
Yeah, I think we're all finding as a field that they're getting into sports earlier and also, again, specializing in those sports. So I understand them really enjoying one sport. I see it a lot in baseball. So baseball, they'll start early on and only play that sport and do travel ball. So they're doing it year round. And you want to encourage them to be involved in sports, but I also want to encourage them to be involved in other sports too along the way.
Can you treat patients who are just have an active lifestyle and not really a sports,
Yeah,
type
absolutely.
person?
Yeah, that's a lot of what I do. Active as far as, like our CrossFit people are marathon runners, weekend warriors. Yes, absolutely, we do that.
The latest craze is pickleball. Have you do you see any pickleball injuries? Or I mean, you go from your sofa to like all of a sudden being active.
Absolutely,
What,
yeah.
what are some tips about that?
I think it's important too, if you go from being not active to jumping into something like pickleball, you do want to gradually work your way there. And that's something that we can meet about and discuss and see like how can we get to that goal of playing, pickleball and not, run into problems doing that.
It's hard to just kind of go from 0 to 100, without
Right.
having any
That's where we see that
guidance.
injuries happen. Yeah.
So how does sports medicine differ from orthopedic surgery?
Yeah. From my standpoint, you would come in initially to see me. We discuss what's going on, do what we need to do in order to diagnose it, and maybe ordering tests and maybe me doing an ultrasound if I think that's warranted. And depending on what it is, coming up with a treatment plan, a lot of times working with physical therapy, potentially doing some type of injection for that, and hopefully getting you back to health, If there is something that I see initially that would warrant surgery, then I would send over to the orthopedic surgeon to take a look.
So when it needs surgery, then it needs to go over
Absolutely. Yeah. If
there.
there's a question or I want to get another opinion, then I would send you over to orthopedic surgery. Yeah.
How does this specialty, now we're offering this, benefit our patients and our community?
Yeah, I think it takes a team approach. So just being a part of that team of getting the message out there that we should all be active, because I think we all know that there's a big problem with obesity and sedentary lifestyle at this point, and encouraging people to remain active all the way through life. I see that as being a big part of my role in sports medicine.
Right, and staying safe while you do that.
Exactly. Yeah. Getting, working your way there if you're not as active currently.
Are there any misconceptions that people have about sports medicine?
I don't know if there's a misconception about it. I think a lot of people have a question as to like what it entails, and basically it's like we had talked about, it's seeing all age groups. So there's nobody too young or too old to see a sports doctor. If you have, joint pain or you think you might have injured something, you absolutely can come see me, and I think that's just getting the message out there of what we actually do.
And again, like if someone was just getting started with sports, is it a good idea to maybe have a consultation with you
I
or
think so.
something like that?
Yeah, absolutely. Depending on, again, if it's a younger kid that's getting involved, yeah, we can talk about what sports you want to play. And then based off of that, what are some things that we can do to get you ready for, to prevent, injuries. If it's an older individual that wants to start being active and maybe used to be, was a high school player or something, then we can absolutely meet and talk about what your goals are.
So what are some of the things that you tell people to do? Like if they're trying to get back into being
Yeah.
more active?
If you want to be active, So if you're not doing anything, you kind of, fell off a little bit, you want to get back into fitness, I usually tell them to start off with something light, like an aerobic type of, we'll come up with that. I actually write prescriptions based off this, but how
Really?
often you're going to do it, what intensity
Hmm.
that you're going to do it at, and for how long. And so then based off of that, when you come and meet me again, we'll see if we can progress it a little bit.
Hmm.
So the idea is you don't want to get too sore. You don't want to put yourself in an awkward position that you would get hurt, because then you're out for a while. So it's staying in the game is the main.
Right. And does this differ based on your age group? Like once you start getting a little bit
Yeah,
older?
it would depend on how functional they are at that point, and depend on maybe what are some of the other medical problems. Have they had surgeries? Just kind of their history in general, and it will help us to come up with a plan together to see what we can do.
Hmm. I know there's a lot of like sports camps during the summer. Do you
Hmm.
recommend those for the student athletes?
Do you mean like high school sponsored
Yes,
camps and
like
all?
high school sponsored camps or camps that, like, we even have some
Hmm.
training camps at our performance training center. Are
Yes.
those
Yeah,
beneficial
I
for
think so. Yeah.
student athletes?
Yeah. For the younger kids, if they're doing, say it's a soccer camp sponsored by a high school, I think it's good for them to get out there and those older athletes show them, the proper techniques and all that. And yeah, as far as the performance center, if you're someone that's not as active, like we had talked about,
Hmm.
then it may be a good idea to go and have those professionals show you how to do things. And, yeah.
Right. I know you're very active in our community with our sports teams. Tell us a little bit more about what you do.
Okay. So yeah, so my role as the sports director is really I am working with athletic trainers in our department, and there's one at each high school currently. I mean, we'd probably like to
Hmm.
grow that in the future, right? But
Hmm.
that's what we a
So
lot of
all
the
7 high
times, yeah,
schools.
yeah, all 7 of them. And if there's an issue at one of those with one of the athletes, the trainer gets in touch with us, and I set them up in clinic here.
I mean, it's nice to have that guidance right there on the
Hmm.
sidelines when they're playing or practicing,
Hmm.
injury prevention. So, what is the one main thing you want people to know about sports medicine?
Um, I guess that it's that we can be the first person that you come to see when you have one of these issues. Um, if if you're having joint pain, if you're injured, doing anything, you can set an appointment. Come see me. We can see what's going on. So we
Okay.
can be the first person that you see, or and to help you take care of that problem.
Yep. Establish a
Hmm.
relationship. All right. Well, thank you so much for spending some time with us today. We enjoyed the conversation.
Thank you all for having me.
For more information about sports medicine at Terrebonne General Health System, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get podcasts. Thanks for joining us.